A variety of studies have shown the effectiveness of low-intensity shock waves for the treatment of vascular erectile dysfunction. As a result, the actual guidelines of the European Association of Urology recommend the treatment of vascular erectile dysfunction with low-intensity focused shock waves as first-line therapy. This presentation compares the suitable shockwave devices and their application technique based on the treatment of 150 patients suffering from ED. The treatment using focused shockwaves has been well known in the medical field for over 30 years. It all started in the early 80s when point-focused shockwaves with high pressure and high energy levels were used in urology for extracorporeal stone fragmentation. Later in the 90s, shockwaves with lower intensity became a gold standard in orthopedics for their anti-inflammatory effects. From the beginning of this century, low-intensity shockwaves have been used to induce angiogenesis, one of the main action mechanisms to treat ED in the target tissue. The development of new therapy sources that create linear-focused shock waves also enables a more homogeneous adaptation to the cavernous bodies and faster application of the shockwave energy. In 2004, Nishida published that low-intensity shockwaves ameliorate ischemia. This was followed in 2010 by the famous Vardy study that showed that low-intensity extracorporeal shockwave therapy has a positive effect on erectile function. In addition to this groundbreaking study from Vardy, more than 40 other studies were carried out that confirmed the positive effects of low-intensity shockwaves on angiogenesis. Based on these experiences and studies, in 2013, low-intensity shockwave therapy for ED treatment was recognized as an eligible method of first-line therapy for ED by the EAU guidelines. This comparative table of all currently suitable low-intensity shockwave devices to treat ED illustrates the different treatment options and focus shapes. Medispec ED and Storz Duolith are using pinpointed focus shapes to treat the condition. Richard Wolf Elevation Piezo Wave 2 and Direx Renova use linear-shaped shockwaves with a special ED technique called linear shockwave tissue coverage, or LSTC ED. From February 2013 to April 2015, altogether 150 patients were divided into 4 groups and treated with these 4 devices. Basically, 3 types of shockwave applications are feasible. Figure 1 illustrates the multiple shockwave application with a pinpointed focus shape of the Storz and Medispec devices. Figure 2 shows the lateral application of the Richard Wolf and Direx devices. Figure 3 and the figure on the right show the complete coverage of the target tissue by the LSTC ED technique with the Richard Wolf Elevation Piezo Wave 2 device. This innovative treatment, introduced by Piezo Wave 2, involves the direction in which the energy is applied and a course of treatment that entirely covers the cavernous bodies. With this device, the energy is applied at a right angle to the cavernous bodies by moving the therapy source longitudinally across the penis and perineum, completely covering the target tissues. This video clip shows the LSTC ED treatment covering the cavernous bodies, followed by the involvement of the crura penis. In total, 4,000 shocks were applied per session with an energy flux density of 0.16 millijoules per square millimeter. Every treatment session took an average of 8.5 minutes and was repeated 1 time per week for 1 month. The evaluation of the treatment was done using the International Index of Erectile Function 5, or IIEF-5, along with our own Treatment Assessment Questionnaire, or TSQ, consisting of the following 4 questions. Question 1, satisfaction with the treatment. Question 2, pain assessment during the treatment. Question 3, sexual life improvement after the treatment. Question 4, recommendation of the treatment to other patients. The answers were scored from 1, very satisfied, to 5, dissatisfied. The following results were determined 1 month after the end of the treatment. The average success rate ranged between 71.2% and 81.33%, depending on the type of evaluation, device, and the technique used. Secondly, mean IIEF-5 score increased from 13.6 to 21.4. Third, according to the TSQ, nearly 87% of patients showed some improvement in their sexual life, scoring 1 to 3, and over 90% would recommend this type of treatment to others. Lastly, 98% of the patients felt no pain during the treatment. Based on our experience and observations, we can conclude that Richard Wolf Elevation Piezo Wave 2 has proved to be the most effective device for low-intensity shockwave ED treatment. The main reasons for this statement are, first, the linear therapy source, together with the LSTC ED technique, guarantees full tissue target coverage and therefore the best treatment results. Secondly, its use of a frequency of 8 Hz results in the shortest treatment time while maintaining a sufficient amount of energy during the procedure. Thirdly, the device is compact and very easy to use. And finally, there are significant economic advantages. Acquisition costs and costs of operation are exceptionally favorable.